want to start off with just planting this in your mind of if you found out you had 6 months to live, how would you want to live your life? And that's just going to be like the theme of what we're talking about today. Um, Let me see. So while I let that marinate with y'all, I'm just gonna go in a little bit more about myself. So again, my name is Jessica, pronouns are she, they. I come from the Filipino culture, and for me, I believe that my Filipino culture has been like such a big cornerstone in how I see the world. All of our cultures, all the pieces that make us up are influencing how we see the world. And for me, what I just knew when I was little was that I just wanted to help people. I wanted to help my mama cook. I wanted to help my grandma take herself down to, my grandma would go crabbing and fishing every Sunday after church. Okay. And let me tell you, sometimes, you know how it is out here in Washington, it's raining all the time. So crabbing and fishing in the rain isn't the best, but I wanted to help my grandma. So, that's what I was trying to do. Originally, I do have to say, I want to be upfront and transparent with you guys that originally I went to UW to be in pharmacy. I wanted to be a pharmacist because with me, I basically grew up in hospitals and in the pharmacy because of my medical conditions. But for me, I was like, okay, pharmacists, they're like someone who's in the community that can like teach you a little bit about your medicine. Because, like take this at this time, make sure you eat it with food, that kind of a thing. But then I came to realize that, being in a lab was not for me. It was not the way to go. I was not down for wearing, the lab coat in a hot room, trying to figure out titrations and all of that. That was not the way I wanted to live my life. But yeah, so I had some conversations with a couple of my family members, and one of my aunties, she was a social worker, and she was telling me about social work, and she was saying about like the real focus of social work is social justice and empowering folks working against and through systems that have been shaped to oppress so many groups. And that just really sparked it in me, because how many times had I played translator for my parents? How many times had, someone, looked down on us because this, that, or the other thing? When you're calling in to make an appointment, you have to talk to a specific person, and both my parents have accents. And so, sometimes the days and times would be wrong because they didn't understand what my parents were saying. Yeah, so just really being that piece that comes to act as not a leader, but, someone who helps to walk along people, that doesn't speak for them, but, helps to figure out what tools are needed. What strengths do you have that we can use against the system? Where are the gaps that the system has put in place intentionally to keep you out of the place where you want to be, Let me see. So I decided to work with older adults just to begin with, because like going back to us talking about Filipino culture, we love our elders. We are so happy to have, our moms live with us, our grandmas live with us. Living in a multi-generational household is, the norm. Seeing your grandparents every week is the norm. It would be so silly for you to, make a decision without consulting somebody older than you, And so for me, just like seeing the way that greater white American society treats older adults just really, really, really irritates me, because, as soon as someone isn't able to produce in this capitalist society, you're out. You don't have value anymore. And like, we don't want to see you. We're gonna put you in a home. And like, what does that really look like? Why does care stop when you can't produce anymore? Yeah, so that's why I got into work with older adults specifically. When I graduated from high school, I went into UW, like I was talking about, and the University of Washington has a School of Social Work program, and I got rejected my first time. Like, I want to be truthful with you guys. I got rejected my first time, and I was like, okay, that hurt, because I was, I had all my hopes in this moment. I just really wanted to be here. I wanted to do this work. And, it just didn't pan out. But then I stayed on for another year. I took that hit. I stayed on for another year, got some more credits in, got some more information about social work, and I got in on the next year. Something that's great about the UW is that if you do your bachelor's at the UW, you can do your master's degree within 1 year, not 2. So you got to go. So that's what I did. It's called the Advanced Standing Program, and it's basically a fast track. And, I learned so much. I was working with older adults in my internship at my bachelor's level and at my master's level. And I graduated this last year in 2020 during the pandemic. I did my graduation on Zoom. My mom hated it, but what are you going to do? And, I was trying to figure out like what it was, like how did I want to be in social work? What does this look like for me? And the opportunity to work at Evergreen came up. And, hospice, the difference between hospice and healthcare in general, I feel, is that hospice is comfort-based care. A lot of healthcare is based in treatment. It's like, okay, you have heart disease. How can we treat that? You have kidney failure. How can we treat that? Versus, when your entire life becomes trips to the hospital, like, are you really living at that point? Are you really, finding joy at that point? What does living and life mean to you when, you can't see people that you want to see because you're in appointments all the time? You are, you're just inundated with like nurses and doctors telling you about how your body is failing, so if you had 6 months to live, how would you want to live your life? That's really what hospice is about. And what I do as a social worker is I do that advocacy part. I work with families to make sure that they have what they need to live out the rest of their life for however long that is. If that's 3 days, if that's, 6 months, 6 years, that's where we are as part of the bridge. We help to bridge that point to make sure that there aren't as many barriers as there could be in between a patient and their family and how they want to live and go out of this life. So I think right now I'm going to stop for questions really quick.
Oh, here we go. How has working in hospice affected you day to day, your day-to-day life?
Love this. Yes. Okay.
Good
So
question.
I think working in hospice, this is going to sound cheesy and it's going to sound fake, but working in hospice has really made me appreciate life. Because like the truth of the matter is when you work in hospice, patients come onto your service and they will die. Like that is how it is. And so, my patients, they tell me all of the things that they loved about their life, all of the things they wish they had done in their life. they tell me about their regrets. They tell me about, the dreams that they had. And so it has really opened up my eyes to see, where are the opportunities for joy and how and what's keeping me from doing that. This is going to sound silly, but I had a patient and she was like, when you think of a lady, she was a lady. She had the rings, she had the perfume, she had her eyebrows tattooed for the gods, her hair was done. She did not allow anybody from hospice to come by unless her hair was done. And I was like, this is the kind of auntie I want to be when I grow up, okay? And she was telling me about how whenever she had a trip, she and her husband would go out and on vacation, and she would buy a little something because why not? Why not treat yourself to something that you enjoy? And I really thought about that, and I was like, yeah, why don't I treat myself more often? What's keeping me from being as kind to myself as I am to other people? As as a woman of color, I have been taught and socialized to treat people better than I treat myself, to make sure that other people are taken care of before I take care of myself. You give plates to everybody else and then you eat, that kind of a thing. And like while I love caring for people and I value care, I really need to care for myself too. And yes, I know that you guys are tired of hearing about self-care, but it really is like that. Okay, it really is like that. And I made, what was it? Something small that I did for myself was like every week I try to get myself a little treat. I have a stupid, incredible sweet tooth. And so it's like, yes, I will have one dessert. That's not something that I made. I will go out to Starbucks and get something for myself. Yeah, it's just like those little things really do make a life, Yeah. Ready for the next question.
Next question is, what courses for high school do you recommend taking for social work?
Okay, so if y'all have any classes on psychology, that would be helpful because, trying to figure out where people are coming from is one of the biggest parts, because if you don't know where people are coming from, you're going to take a lot of stuff seriously. You're going to take a lot of stuff personally. And, when you're doing social work, it's not about you, it's about the patient. It's about what their needs are. Because if I'm coming in as a clinician, I am the person who has the ability to change. Because, I can't just come in and tell people what to do, because, no one's going to do something if they don't want to. So, like psychology is like that kind of a thing. And, if you guys have any courses on leadership, leadership is also a really great course to take, because it really teaches you about who needs what right now. What is the goal right now? Sorting through, 17 different voices happening and trying to figure out who needs the most, what can wait, where am I, how am I feeling, what do I need, even though I'm the leader, that kind of a thing. Let me see. And also history courses. I'm going to say this, I'm going to preach this. History courses are so important, because if we don't know our history, we're going to, you already know. You already know that we're repeating stuff. Stuff is still happening. So if you want to break the cycle, you need to know how it started. That's it.
Great. That's wonderful answer. That came from Fernanda, and another question, the first question also came from Alma. I'm sorry, Alexa.
Oh, Alexa.
Alexa also asked, does it become overwhelming at times?
Yeah, it becomes overwhelming. I think that the hard part isn't that it's overwhelming. The hard part is to not let yourself become hardened, because when you stop caring, that's when you're in trouble. Because if I stop caring, how can I be there for people who like need me, who are looking for me? When you block yourself off, you can't be present and you can't hear people, you can't meet them where they're at, you can't see them for who they are, because you're just like in your world, you're not trying to reach out. And so when you're blocking yourself off, you know, that's kind of like where it ends. And so for me, the overwhelming part is, I have patients who are dying. I have patients who are sick. I have patients who have bed sores. I'm not sure if you guys have seen those like World War II movies, and there's like there's a patient in a hospital and they have gangrene. Gangrene is still real. I want to let you guys know that right now. Your body will deteriorate when you're older, because it's trying to make sure that your heart is still pumping and your brain is still working, basically, so other parts of the body shut down. And so like seeing gangrene in real life is really hard, but hearing those stories from these patients, that's worth it. And making sure that you're okay is also one of the biggest parts, because if you're okay, you can do your part to make sure that the patient is as okay as they can be. Because like, you're not there to save anybody, right? Because if you're out here saving somebody, you have an agenda, and that's not okay. The patient is the person who sets their goals. And so if they're wanting me to, if they're wanting me to talk to their daughter about, hey, I never told you about this, but that kind of a thing, I can't do that, right? If I am closed off. But if I am ready to receive that information, if I'm ready to receive, all of that heart and all of that life and all of that story, I'll be okay. And yes, I do have to say, I am in therapy. I do self-care every day. I do make sure that I talk to somebody. I reach out to people who have more information than I do about certain diseases or anything like that, to make sure that I understand what's going on. I don't just go in there like, yes, I will listen to you. No, I'm human. And yes, I do get overwhelmed, but like, when you're doing what it is to make sure that you aren't burned out, like, that's a system that I make for myself. Will I get burned out in the future? Hopefully not. But that's how it is. And at that point, use your vacation time. That's what I'm gonna say to you guys right now. Use your vacation time. Okay. Like, Black and brown people are out here like, no, I'm gonna take it. It's okay. It's fine. No, use your vacation time. It's there for a reason.
That's such a good suggestion and tip to take seriously, because I
Right?
sometimes have issues doing that myself.
Mm-hmm.
But
Use your vacation time,
awesome. I
Noel.
appreciate your openness and honesty about it all. This is wonderful.
Mm-hmm.
Okay, so if you have some more to share, I think we have, what is it about? Are we going to 4:50? Is it?
Yes, we have about 9 minutes left.
Yeah, 9 minutes. Okay.
Okay.
All right.
Cool. Let me see. So yeah, if you guys have any questions about dying, if you have any questions about what it's like to die, you can ask me that. I know that stuff. I haven't died and come back from the dead, but I have been there with folks at the bedside. Let me see. But yeah, so I think that for me, please send in your questions, but something that I really want to leave you guys with moving forward is, how would you want to live if you had 6 months left, right? So just take that as your little seedling from this talk. But yeah, any other questions in the chat, over the mic? Either way is good.
Do you out to ask a question? So does your spiritual health have a major impact on how you deal or balance your life?
Oh, absolutely. And to put that, to expand on that a little bit, spiritual health isn't just like faith, right? It's that feeling of, you know, what else is out there? That feeling of hope, that feeling of vulnerability. And yeah, I think about that a lot. I feel like I'm very much in my feelings and my spirit a lot, because it's, in a way, it is spiritual work, because this is the moment, one day you're here, one day you're not, trying to figure out about, what does this transition mean for me? Making sure that, that there's always hope for me in my work, that, I do my part so that my patient lives until their last breath, because you're living until your last breath comfortably. That's really that hope for me.
Awesome.
Mm-hmm.
There is a question from Fernanda. She has, what other jobs are similar to yours?
Okay. So jobs that are similar to mine. So on my team, in hospice, there are nurses, there are social workers, there's certified nursing assistants, there's chaplains who do emotional support, faith support, spiritual support for patients. But if you're looking, so that's like hospice. If you're looking more for what I do as a social worker, advocacy, being an advocate, that is so, hand in hand, right? So if you're looking to do stuff politically, if you're looking to do things on a systemic level, that's another place for you to go. Doing research related to social work, related to, social justice is so important. We also have folks who are counselors. Social workers can also be counselors without doing the mental health route in school.
Thank you very much. There's a question I see from Alexa. How much is that? I can't really tell. BIPOC representation is there in hospice work?
Yeah, how much representation is there of Black, Indigenous, people of color in hospice work? I hear you. Well, when it comes to hospice, because of the way that we've been socialized, there are a lot of BIPOC folks in the more hands-on aspects. So there are a lot of certified nursing assistants. So the folks who come in to help with bathing, the folks who come in to help with feeding. We also have a lot of nurses who are BIPOC folks, because, we're taught a lot that, POCs can't be doctors. Next best thing is being a nurse. But when it comes to social work, for me, when I was in school, around half of my graduating class was people of color. And let me see, my graduating class for my undergraduate degree, also in my master's degree, which is nice. Yeah. Are there any other questions?
I see, Amanda, you had put something in chat. Did you want to elaborate on that at all, or?
Yeah, sure. So essentially, this is just the attendance form that you've seen. If you filled it out already for all 3 of your or 2 of your sessions that you attended today, then you're all set and you don't need to do anything. If you have not filled it out for this session yet, do feel we hope that you will fill out the attendance form one more time, just so we have a little bit more data as to what people are interested in and what people enjoyed.
Great, thank you. Are there any other questions for Jessica? Okay, so it looks like we are, what, at a couple of minutes here?
Okay, perfect. But yeah, so I guess I just wanted to say thank you everyone for coming.
Good weekend, everyone.
Thank you. Yes. Yeah, I wasn't too sure who would show up today. I was honestly prepared for there not to be anybody. But yeah, I hope you all have, learned a little something, interested in social work. I'm always happy to have more social workers in the world because, yeah, even though it's been, I think, like 150 years since the beginning of social work, there's still a lot of white women up in here trying to make so many decisions. So I hope you all have a good day and remember to take care of yourself, eat well, sleep well, make sure that you do something for yourself once in a while. And let me see. Yeah, I think that's good. Oh, also snacks. Snacks are also important. Make sure to have those in your backpack. I have more than enough snacks in my backpack to feed a whole classroom. So thank you.